We're creating a forum for discussion at multiple levels, providers, administrators, key stakeholders, but also patients, and I think it's just terrific, and the conference here is wonderful.
The way that we're looking at this today and beginning to view this completely different than we ever have, to me is amazing. That's why I'm so grateful to be here, to talk about that connection between housing and healthcare.
I find it's really informative, and it gives me kind of more insight into the political landscape and the policy landscape.
Whether it's medical home, quality indicators, payment reforms, especially on the Medicaid side, Oregon has led those.
I was where you are 2 years ago. And if you would have told me 2 years ago that I would be standing and debating Governor Kate Brown or talking about politics, I'd say, yeah, I don't know, you don't know what you're talking about. I wouldn't be anywhere near there.
Investments in the social determinants of the health are going to move us much farther towards a healthy population and a healthy community than simply spending money on medical care.
I think Dr. Kitzhaber hit it out of the park in terms of where we need to go in the future with healthcare. His vision of where the dollars need to be spent and not spent in the healthcare system, I think, is spot on.
And the traditional mindset of a physician group, an independent physician group, has been, let's sit back, position ourselves, watch what everybody else is doing, and then join in after everyone's made the mistakes. That approach needs to change.
What's the next chapter in Oregon's 30-year story of healthcare transformation going to say? Because you're going to write that chapter. You're going to write that chapter through the actions you take, the attitudes you take, the partnerships you take, the collaborations you enter into over the next year.